And today on the HRN News at 7, we're going to be kind of looking into something that we all deal with. We all need at least a big chunk of our day, maybe a third of our day, if not more, and we're talking about sleep. It's very important, often overlooked, and there's a lot of different paths and pitfalls people fall into. Today we're talking with Dr. Ronald Popper, who is located in Thousand Oaks, California, and is the founder of a medical director of the Southern California Pulmonary and Sleep Disorder Medical Center since its inception back in 1984. Dr. Popper is a board-certified sleep disorder expert, Board of Internal Medicine, and Specialty of Sleep Medicine, and is recognized as one of the pioneers of sleep medicine. Dr. Popper, welcome to the HRN News at 7.
Thank you for having me.
So you have been dealing with this for quite some time. I think people have been dealing with sleeplessness for quite some time, which led to a lot of the myths and things like sleeping pills. People try to medicate with alcohol and some of these. Tell us, number one, why those are certainly not the best advice to get a good night's sleep.
Well, sleeping pills, aside from being addictive over the long term, don't really take care of the underlying problems of insomnia, which most of the time are due to behavioral issues. Alcohol, for instance, people use for sleep sometimes. Alcohol will make you sleepy, but as the alcohol gets metabolized, it actually causes multiple arousals throughout the night and poor quality sleep.
Yeah, that's always such a myth. It'll definitely get you sleepy and get you to sleep, but waking up multiple times throughout the night for various stimulus, arousals, or even have to go and relieve yourself from a full bladder. So,
correct.
Now, how did you begin working on all of your research and helping with sleep disorders and eventually also with sleep apnea?
Well, I was actually in a pulmonary and critical care fellowship in West LA, and we had to do research, and I didn't want to do animal research. I only wanted to do research with humans. And as a pulmonary fellow, that wasn't part of what was recognized. You needed to be an actual professor to be doing the human research. So it was kind of as a punishment that I got banned to a little 8 by 10 foot room and asked to start a sleep center at VA Wadsworth in West LA. And we started working on this disorder at that time called obstructive sleep apnea, which was relatively new. And that kind of snowballed and got me interested in all aspects of sleep. And it's been a real journey ever since then.
So many people hear about sleep apnea, which essentially is the blocking of the air passageway, and sometimes we'll scare our partners and people that we, family members and significant others that we're sleeping in the same room with, either loud snoring or what actually leads to the a little bit more of an alarming sound through the apnea reaction.
Correct.
So I know some of the first methods were the those big masks that people are wearing. Are those something that are you still working with those, or have you moved on to some other ways to help people get quality sleep?
Well, there's lots of different ways to address obstructive sleep apnea. CPAP, which is the mask you're referring to, is still the gold standard of treatment because it's the only treatment, short of doing a tracheostomy or a permanent hole in your neck, to bypass the obstruction. CPAP is 100% effective at eliminating snoring and apnea. The problem is the acceptance by patients is certainly less than 100%. So other alternative treatments have been designed, and the two most common ones that I use, or three most common ones I would say that are non-CPAP related, would be eXcite, which is the newest treatment option for people who just snore or have mild apnea. There's another device called Bongo, which is a form of CPAP but without needing the mask or the machine, and then various oral appliances that the dentists make. And their success kind of declined in the order that I gave them to you, with eXcite being the most successful, Bongo the next, and then the oral appliances below that.
And essentially people would have to go to pretty much a dentist to kind of get these fitted before, which, I don't know, most people go there to get their cleanings, fillings, and whatnot, but it sort of fell under the dental doctors to kind of help out people with this issue, and then now we're getting more.
Not entirely true. The dentists are involved in the oral appliances.
Okay.
They're not really involved in the Excite or the Bongo or the CPAP.
So essentially, to get sized, you have to go to a dentist, but you have some other things. Tell us a little bit about these methods. Let's start at the top with the Excite.
Well, the Excite is kind of a novel approach. It's the only therapy that actually is done during wakefulness. This is basically a stimulator for the tongue muscles to get the tongue to contract, with the idea being that you strengthen the tongue so it doesn't fall in the back of the throat and block the airway. And it's utilized for 20 minutes a day for the first 6 weeks, and then twice a week thereafter for 20 minutes a day. And I can tell you from my own personal experience, because I have snoring but not sleep apnea, so I tried this out. And within the first 2 weeks, my wife told me my snoring disappeared. And I've been using it now for about 4 or 5 months, and I rarely have any breakthrough snoring. So it's very effective for snoring and mild sleep apnea, and it's very convenient and very tolerable.
Now, as a young kid, I actually went through something called myofunctional therapy, which was something for individuals who are tongue-tied and have like a piece of webbed skin at the end of the tongue, and I had to learn how to re-swallow and do a lot of different things. But this seems something that, God, I wish they would have told me this back when I was in grade school.
Well, I don't know that this is going to take care of your being tongue-tied, but it certainly takes care of the snoring and the sleep apnea.
No, definitely makes a lot of sense with that all kind of working in there. So a number of different exercises, and these are, you would be able to take a patient and talk them through this and lay out the exact exercise and have some kind of a demonstration so they could begin to practice and essentially like going to a gym but working on the tongue muscle as opposed to biceps and chest.
Correct.
Excellent. So that is the Exciter. Now, Dr. Popper, what is number 2 on the list, the Bongo effect?
Bongo is a little plug. It goes in each nostril, and when you breathe in through your nose, it has a little valve on it, and the valve is wide open, so it doesn't cause any resistance. But when you exhale through your nose, it resists the pressure exiting the nose, so the pressure backs up into the nose, spreading the tissues apart and keeping the airway open, much in the same way as traditional CPAP, but simply involves these very small plugs that you fit into your nose. And this will eliminate snoring and apnea about 70 to 80% of the time if you fall into the range of pressures that the Bongo delivers, which is generally about 8 to 12 centimeters of water pressure, where traditional CPAP you can adjust from about 4 up to 25, so you can really dial in an exact pressure, which is why CPAP is so much more successful. But 80% of patients fall into that 8 to 12 centimeter water pressure range, so it's a reasonable option for them to try.
Oh, and I'm assuming probably not quite so costly and definitely not as cumbersome of putting on and taking off each night and getting up each morning.
Exactly, and very much more portable if you travel with the Bongo than with the CPAP machine.
Yeah, that's good to know. And the third on the list were some of the traditional, or I guess new, of the various oral fittings. What are some of those?
There are literally dozens of variations, but what all of the oral appliances do essentially is lock into your upper and lower teeth, and by various mechanisms, they bring the lower jaw forward, which brings the tongue away from the back of the throat. The oral appliances, almost regardless of which style you get, have about a 50% response rate. And in the group that responds, they will typically improve their sleep apnea by about 30 to 50%. So it's really meant for patients who are just snorers or have mild to moderate sleep apnea, but is probably the least effective out of the 3 groups that we just talked about.
All right. Now, obviously, when we're asleep, we don't know that we're snoring or maybe having a moment that would turn into apnea. Normally, it's a family member, loved one, significant other who might say, "Hey, I didn't get any sleep last night. You were snoring, or I had to bump you a couple times. It sounded like you were going under." Now, obviously, our significant others, our family members, aren't exactly trained to know exactly what is sleep disorders or what have you. They know they're not getting a good night's sleep. So now to decide in which of the best way to take care of sleep disorders, it's obviously best to come into a sleep center and be observed by a professional like yourself, correct?
Correct. Yeah. The problem with spousal observation is the spouse goes to sleep, they may be missing the apneas and only complaining about the snoring.
Mm-hmm.
Snoring is way more prevalent than patients who have apnea. But when they come in for an evaluation and we examine their upper airway and we can see the upper airway obstruction from the excess tissues, we can certainly suggest that they have apnea, even if it was never witnessed by their spouse. And then we would prescribe a sleep study either at home or in the sleep center, depending on what their other medical issues are, and we can make a definitive diagnosis based on those studies.
So it definitely is a step to be seen by a professional in this kind of environment. Obviously, people at home are only going to pick up so much and know that there's an issue. So it's good to know and be diagnosed and know that there's a lot of different options that don't seem to be as cumbersome or as complicated. Even though, as Dr. Popper said, the CPAP machine has worked for I guess millions of people with these disorders. Correct?
Absolutely.
So
it's still the most prominent form of treatment that we use.
Okay, so it still might be a possibility, even though some of these others might be there for some others who maybe don't have an extreme case to go all the way with the CPAP.
Correct.
All right. So, Dr. Ronald Popper, where can our listeners find you, and where can our listeners find out more about you in case they have a spouse going through this or might be wondering about this themselves? You're located here in Thousand Oaks in Southern California?
Correct. And our website is www.sleepmd, like medical doctor, the number 4, the letter U.com. And you can get all kinds of information about not only sleep apnea, but other sleep disorders and their diagnostic and treatment methodologies. You can also call our office at 805-557-9930. And we're happy to answer your questions.
All right. And online that is sleepmd4u.com?
Correct. That's it.
All right. Now, obviously, we also deal with a lot of different outside stimulation, which, that might fall more under, lifestyle considerations. Do you counsel your patients or people coming in with, things like trying to keep EMFs down or, diet and stuff like that, in addition to just what is happening, with the airways of the mouth passages?
Absolutely. Yeah, we always take a holistic approach. You need to have good sleep behaviors, good diet, exercise, weight control. That all plays a role in not just good health in general, but good sleep health as well. And we have what's called sleep hygiene. That's on the website, and other recommendations for appropriate sleep behaviors.
All right. So again, Dr. Ronald Popper is located in Thousand Oaks here in Southern California, near the Los Angeles area, and they can find out online at sleepmd4u.com. And one more time with your phone number, Dr. Popper.
Yeah, 805-557-9930.
All right. Well, thank you so much for taking time to educate us about sleep disorders. I know we're on early in the morning for a lot of people who might be feeling the effects of a groggy night or many put together. So hopefully this will be insightful for many of our listeners. And Dr. Popper, thank you for letting us know that there are many options and help is available.
Thank you for having me.
All right. Once again, Dr. Ronald Popper today on the HRN News at 7.